Hi folks, Dr. Drea. It's been a while. You know I'm driving. You know I'm probably pissed off about something if I'm making a video, right? So, had a patient and she had just had her yearly pap smear done, and she tested positive on her test for other on the HPV screening. Did you know that they have 3 different essentially tests that you can be positive or negative for? HPV 16, HPV 18, and then HPV other. Other doesn't really cause cancer. People are told it does though. It's exceedingly rare. It more likely is just indicative of a chronic infection in the body. Not really going to do what you're told it will do. Can cause things like genital warts, but really it's just an infection in the body. And the treatment is a colposcopy or a LEEP procedure. So colposcopy, when they put you under magnification in the office and then essentially burn your cervix off, and then a LEEP is when they cut a chunk of your cervix out. Super unnecessary. Actually increases your cancer risk every time you have one of these procedures done, and they treat it as if it's nothing. But that wasn't the worst. So she had this colposcopy done because she was told, ooh, cancer risk. Lies. But the worst part was after that procedure, the doc hands her a freaking tube of estradiol. Estradiol being the inflammatory form of estrogen. You know, the form of estrogen we know causes cancer. Cervical cancer, uterine cancer, breast cancer. Synthetic HRT estradiol. Not a bioidentical, not a soothing lubricant agent. No, estradiol. She showed it to me, I took it and I threw it in the garbage. And after I explained to her what it was, she threw it too. So ladies, do some freaking research. Don't just do procedures if you don't know what they're for and you haven't actually looked into, do you even need the procedure? If you test positive for HPV other, you do not need a colposcopy. You do not need a LEEP. Likely you leave it the hell alone and the body will fix it on its own. And on top of it all, don't just take estradiol, especially HRT estradiol. You always have to mitigate estrogen with a little bit of progesterone. You must do that. You have to do it to control all of that inflammatory estrogen that causes cancers and diabetes and estrogen dominance that leads to all sorts of other problems. Please, ladies, please listen to me, please, for your own good.